All right, I think we have a good number of folks on the line now, so perhaps we can go ahead and get started and recognize some other people may trickle in as we continue with the webinar. So I'm happy to kick things off before turning it over to the panelists that we're very excited to have joining us today. So hello everyone, my name is Mary Grace Darmody. I'm an associate on the Global Markets team at the Clinton Health Access Initiative, and I lead the family planning market report efforts from the CHI side. This year, as in each year we've published the report, we're delighted to partner with RHSC on this important initiative. This year, the market report covers data from 2016 to 2020, and we're looking forward to the discussion today and sharing trends and analyses from this year's report. I did want to share some housekeeping notes before we kick things off in full. So we are recording today. This recording will be made publicly available after the webinar for anyone who was unable to join the actual call today. For the agenda for today's call, we'll plan to have our panelists provide introductory remarks. I'll then run through some of the key trends and findings from this year's 2021 Family Planning Market Report, and then we'll open up for Q&A. Given the size of the group that we have joining today, we've muted participants, as I'm sure you can see, so we welcome you to direct any questions or comments during the Q&A portion of this webinar to the Q&A function on Zoom. So without further ado, I will turn it over to our panelists. We're very excited today to have joining us Marie Chantale Lepine, a special advisor at the Clinton Health Access Initiative, John Skibiak, the director of the Reproductive Health Supplies Coalition, and Martyn Smith, the managing director of Family Planning 2030. So perhaps MC, I can turn it over to you to kick us off.
Thank you, Mary Grace. Good morning, good afternoon, good evening, everyone. Thank you for joining us in such great numbers. I know we have 120 or plus participants registered, so it's very, very exciting. It's actually our 7th iteration of this report. And so happy that this particular tool has generated the type of enthusiasm that has kept us moving and continuing to evolve it over the years. Also, we continue to grow. Last year, we had 16 participating suppliers, now 17. So it looks like we're adding a supplier every year, which is great. So welcome to our new supplier. And we really want to take a moment to thank all of our partner suppliers without whom this would not be possible. Thank you for sharing your data with us. Thank you for your continued collaboration. We appreciate it greatly. We also want to thank RHSC, our longstanding partner, and John Skibiak for your invaluable insight and your support throughout the development of this and publication of this report. To Martyn Smith and FP 2030, thank you so much for your input, the conversation, the discussions, always so valuable. Thank you, Martyn. And to all of our other partners and stakeholders for your insights, for the input. Obviously, this is a group effort. It really does take a village, and thank you once again to have been so enthusiastically participative in this report this year. The report measures or will showcase data from the 2020 year, which was a challenging year. You will see some have been surprised by the resilience of the market in 2020, others have not. Mary Grace will walk us through some of the highlights and rationale behind that, but it really was encouraging to see our market's resilience. Obviously, the challenges continue, and we'll see how and what kind of bearing that has in the next year's report. But for now, looking forward to Mary Grace going over all of the highlights for 2020. Last but not least, again, as we always indicate and underline, every year. This is an additive tool to our community's toolbox. It is based on concrete shipment data from our partner suppliers. So we think it continues to be very important, but again, it is but one tool in our arsenal of tools that hopefully enable all of us to make more informed decisions. So without any further ado, I'll hand you over the Zoom mic to my friend, John Skibiak. John?
Thank you, Marie Chantale. And I'd like to join you in welcoming everyone to the launch of this 2020 Family Planning Market Report. As Marie Chantale just mentioned, this report has been a joint effort between CHI and the RHSC, an effort that in fact came into being, I believe, during our 14th general membership meeting that took place in Delhi back in 2013. So quite some time ago, almost a decade ago. I'd like to keep my remarks brief. I certainly don't want to steal the thunder of this year's rich findings, which we'll soon be hearing. But as I was reflecting on what I might say in my opening remarks, I looked back at the reports that have been published since 2015, and I couldn't help be reminded of the phrase "time stands still for no one." And I think each report, although this is a cumulative process, as Marie Chantale said, I think each report in its own way has served as a mirror onto the evolving reproductive health landscape. And if you look from year to year, you can see how this landscape has become richer and more complex and grown. In 2015, there were only 11 manufacturers contributing data to this. Today, we have 17, which I think is also in large part a testament to the growing role of the manufacturers in our community and in the dialogue and in the network that we were working within. Also, the data sources are evolving. When we began with the market report, we were still working in an environment where a lot of the data tools were tools that were established in the early years of the RHSC. And I'm thinking in particular of the Reproductive Health Interchange, the RHI. Over the course of the last 2 years, we've seen many of these tools, the CARS, the CSP, the RHI, been folded into the VAN, which is a much more robust source of data, a much more accurate source of data. And here again, in this year, we see the market report taking advantage of these new data sources, and we see the report tapping into RHVIZ, which contains much of the data that once was in the RHI. And I think probably last of all, I think it's probably fair to say that this report is probably standing on the threshold of a new universe of countries that will shape our analyses moving forward. Earlier this year, we and the RHSC and Avenir published the LEAP report, which in a way kind of put to bed, so to speak, the set of 69 countries that comprised FP 2020 in favor of a broader set of 135 low and middle income countries. And as FP 2030 now sort of takes to flight, I think the range of countries will differ, and undoubtedly our response to that will also evolve to reflect the new priorities of this environment and of our network. So what I'd like to do, again, really, I'd like to close by congratulating the authors of this report and thanking the many people who contributed to it, as Marie Chantale has done, both the authors of the report, the technical providers, the manufacturers, and also the reviewers. There are a number of reviewers who contributed to this report, and I think have made it really the rich document that it is. So thank you very much, and I'd like to turn over to Martyn.
Thanks so much, John, and sincere thanks to to Chai and to RHSC for inviting FP 2030 for this critically important webinar in what, in our opinion, I think is probably the most important market report ever. It's a big week for data, because of this critically important market report. Big week for data because FP 2030 will launch our annual measurement report in the next few hours, setting out family planning progress on a range of more than 20 indicators in this new era of FP 2030. And as John says, we are shifting our emphasis. FP 2030 will now be open to commitments from all countries. And our measurement report this year will actually focus in on the 82 low income and lower middle income countries. And we will report around 357 million users of a modern method of family planning as at July of 2021, as well as this full range of other family planning indicators. But in that report, critically and very much related to this morning's webinar, we look at the impact of COVID-19 on family planning and ask 4 key questions that were based on the hypothesized impacts at the outset of the pandemic. And the first, has the pandemic resulted in delays and disruptions in contraceptive manufacturing, shipping and supply chains? Very much draws upon this market report, and we're very thankful for the partnership with Chai and RHSC. And so I won't scoop any of those conclusions here, but suffice to say that from the onset of the pandemic, FP 2030 countries and partners, including manufacturers, procurers, undertook a wide range of measures to ensure that contraception would still be available. We also feature data on a few other questions that I'll just very briefly mention that are important context in what we're looking at this morning. For example, we explored, did the pandemic shutdowns result in service disruptions in the public and private sector? And in partnership with our colleagues at Avenir Health Track 20, we examined 6 countries where we have service delivery information. And contrary to earlier predictions, 4 of the 6 countries, the actual estimated users in 2020 was higher than expected. In 2 countries, the actual estimate was slightly lower, but in all 6 countries, much of the stability appears to be from implant insertions, which, despite being a provider-dependent method, of course, continued the trend of steep growth in use that we've seen during the last few years. We also examined whether there have been changes in contraceptive use due to the pandemic, and initial results from our colleagues at PMA, their surveys in Burkina Faso and Kenya indicate that most women did not change their contraceptive status and were more likely to adopt a method than to discontinue based on the available data that they have. We have our usual suite of financing data, which is always an important context again to the market report. But just a small caveat there that the available financing data is for 2019 and 2020. So a lot of it does not yet capture some of the fiscal constraints that we've certainly seen during the COVID pandemic. But I think the overall picture that we present, with caution based on the available data so far, is that we are part of a resilient system which responded quickly to the challenges. Those challenges are not yet behind us, but certainly the growth in contraception has continued, and we are moving into the FP 2030 era with great confidence. I hope you've all seen the wide range of new commitments from countries and from a range of partners, some 50 commitments and counting to FP 2030, as well as the new leadership, which is now with us as FP 2030. And I do bring greetings from Dr. Samkuliso Dube, our new executive director, who joined us on the 1st of December. So with all of that, very, very fascinated to see the conclusions in detail for the report, and very much looking forward to the Q&A after that, where myself and my colleague Jason Bremner, our data and performance management director, will be happy to answer questions from an FP 2030 perspective. So with all of that, I think I'm handing back to you, Mary Grace, and we're going to get into the presentation itself. Thank you.
Great. Thank you very much, Martyn, and to all of our panelists for those remarks, and would just reiterate the thanks to all of the participating suppliers and to RHSC for making this year's report possible. And without further ado then, I think we can dive into some of the key findings from this year's report. And I know that we want to get into the discussion in the Q&A, so we'll try to keep this section brief. So this year's findings come from the 2021 Family Planning Market Report, which, as mentioned, covers the 2016 to 2020 period. And this report, as I believe John provided some context on, really comes out of the Global Markets Visibility Project, which was designed to address information gaps in the reproductive health commodities market. So the result of the Global Markets Visibility Project is to foster partnerships among suppliers and stakeholders. This report is one of those key collaborations to really enhance the information visibility in this key market. And this report really is additive as it captures supplier shipment data across a variety of sources, as opposed to just capturing perhaps a subset of suppliers who may choose to opt in to sharing data in public databases. We're very excited to have welcomed a new supplier, Corporate Channels, this year for a total of 17 participating suppliers in the FP Market Report. And you can see all of our partner suppliers listed on this slide, and we're grateful for their collaboration. This report continues to be an important tool for decision makers, funders, governments in the FP space. And this report has really been a critical tool since 2015. It's now in its 7th iteration and continues to provide comprehensive and reliable data related to family planning procurement. The report provides several different analyses, which really lend different angles of visibility into this public sector FP 2020 contraceptive procurement market. The heart of the report is really this supplier shipment analysis, which comprises the main section of the FP Market Report. So the FP Market Report each year collects data from 17 participating suppliers. They share their data confidentially with CHI, and CHI then aggregates critical volume data from these different suppliers for all modern methods of contraception, with the exception of male condoms. Given that male condoms is typically a quite fragmented market, we use RHVIZ data for that particular method, which tends to be comprehensive. And then for all other modern methods of contraception, we use that aggregated volume data from the 17 participating suppliers. With that view across the different methods of volumes data, we can then calculate market value, and we do so using publicly available information on unit prices from the UNFPA Contraceptive Price Indicator. And we've chosen this database as it is consistently updated and publicly available, which is critical for providing this visible and public view of the FP 2020 public sector market value. Similarly, to calculate the CYPs that are shipped across this public sector FP 2020 market, we apply the CYP. CYP is a couple year of protection, which measures the duration provided by different methods of contraception. So we use these CYP factors that are published by USAID to calculate the CYPs that are shipped across this public sector family planning market. And USAID, as I think many people will be aware, published updated CYP factors this year, and those have been factored into this year's 2021 market report. These supplier shipment analyses are then supplemented by donor spend analyses. The two large procurers of contraceptives within this public sector FP 2020 space are USAID and UNFPA. And each year, in partnership with both of these procurers, we publish data and analyses on the contraceptive spend from these two procurers. So for this view of USAID's contraceptive spend, we leverage a publicly available report, the overview of contraceptive and condom shipments data, and then in conversation with USAID, reflect these analyses within the Family Planning Market Report. And each year we work directly with UNFPA's Procurement Services branch to gather data regarding the contraceptive spend across various methods within the 69 FP 2020 countries. Knowing that there's a variety of tools within the space, we of course leverage existing literature. This year's report leverages from RHSC's LEAP analysis, JSI analyses, and a report from the Guttmacher Institute to make sure the market report is in conversation with other resources. And we hold stakeholder conversations with suppliers, donors, and other implementing partners to have a conversation that brings color and context to the analyses and the data that we see each year. So these three sections comprise the main portion of the report, and then the appendix each year contains a deep dive and some detailed tables into procurement volumes by country and method. We explain in further detail the methodology that's used to estimate the size of the FP 2020 public sector market. And then we provide additional market visibility analyses into Bangladesh and India, as both of those markets contain really active domestic procurement landscapes. With that said, we can then provide some context on the trends that we see in this year's report. And to appropriately frame these trends, do want to clarify that the coverage and the scope of the report is, as you see presented on this slide, particular to the 69 FP 2020 focus countries. There are, of course, some updated architectures in the space, but given the timescape that this report covers, it is particular to those FP 2020 focus countries. The report also focuses on the public sector, which for the purpose of this report is defined as including MOH and government affiliated procurement, as well as procurement from institutional buyers, which includes UNFPA, USAID, and social marketing organizations. We recognize, of course, that social marketing organizations could be categorized differently in different reports, but for the purposes of this report, we've included them in the public sector. And then the methods encompassed in this report are the product-based modern methods of contraception, including male and female condoms, oral contraceptives, injectables, implants, and copper IUDs. And I do want to note that the hormonal IUD will be included in the family planning market report as soon as a publicly available price is quoted on the UNFPA contraceptive price indicator. And we look forward to including the method in the report once we're able to aggregate that appropriately and publish it with that public pricing data. Without further ado, then, I think we can share some of the key trends that we find in the main section of this report. So the first trend that you can see on this slide is related to market value. And just to orient to the slide before we dive in, you can see that on the horizontal axis, the years covered in this picture of the public sector market value run from 2016 to 2020. And then all of the value, as you can see on the vertical axis, is noted in US dollars. We calculate market value each year, again, multiplying that publicly available price from the UNFPA contraceptive price indicator per method by the aggregated volume data that we construct from suppliers and from RHBiz. We do tally different shipments based on the date in which they were shipped. So it's possible, let's say, that if an order was placed in 2019, but it actually shipped in 2020, that order and the value associated with that order would be noted within 2020. So I think that timing note is important given some of the dynamics that we see in 2020. There could be some carryover from 2019 just based on how orders are noted in this view of the market. So looking at the trends that we see within this graph, it is notable that the value of this FP 2020 public sector market reached a 5-year high in 2020. So it increased by 16% from 2019, where public sector market value was 224 million, up to 261 million in 2020. This growth in market value is driven by a few different methods. So if you look at the implant segment in dark blue, you can see a notable increase from 94 million to 113 million. There are also notable increases in the green category, which is comprised of combined and progestin-only orals. And then the injectables category in the dark yellow also shows an increase. So these different methods really contribute to this increase in market value, which brings the total to this 261 million number. Looking at market volumes, we can see a similar increase. So this graph again shows the 2016 to the 2020 period. The volumes are noted along the vertical axis. And I do want to flag that the male condom shipment volumes are shown not in this graph, but in the table on the bottom of the slide. And that's done so just given the volume of those orders. We want to make sure that all of the units in the graph are readily visible. And so for scale, we've pulled those male condom volumes out into the table underneath. Looking at this graph, which includes all of the market volumes with the exception of male condoms, we can see a similar 5-year high in 2020. So these volumes increased from 268 million to 329 million from 2019 to 2020. That represents a 23% increase. And similarly, this growth comes from a few different categories. It's the dark blue implant category, that green combined and progestin-only orals category, and then the dark yellow injectables category, which drive this growth. This increase is of a similar scale, but not exactly the same as the increase in market value, which makes sense given the differences in calculations between volumes, which are simply aggregated across suppliers, and market value, which incorporates those different pricing assumptions from the UNFPA contraceptive price indicator. And then if we look at the male condom volumes, we can see below that there's a slight decrease from 2019 to 2020, but still that method continues to provide notable market volumes. And this table is taken from the RHVIZ data source. Moving to couple years of protection then, which also comprises an important view of this public sector FP 2020 market, we can see that if we look at this vertical axis, which shows CYPs shipped from the 2016 to 2020 period, we perhaps see a surprising trend, which is that couple years of protection remain stable from 2019 to 2020, which is notable in light of that increase that we do see in the market value and the market volumes, which bring both of those values to a 5-year high. If we look within these bars, we can see trends that shed some light on why these numbers similarly have not increased. So changes in the method mix really drive this stable trend in couple years of protection, despite the fact that market value and volumes are increasing. In particular, if you look at this copper IUD category, it's in the light blue, you can see that copper IUDs decreased by 14 million CYPs shipped from 2019 to 2020. This is in spite of the fact that the decrease in market value and market volumes from the copper IUD was comparatively small. And we see this trend because the copper IUD has a comparatively small cost, but a comparatively large CYP factor. So we tend to see that when there are decreases in this particular method, it tends to really decrease disproportionately the number of CYPs shipped within the market. If we look at the 5-year view of this method, it doesn't seem as though copper IUDs are perhaps out of what we would normally expect from a procurement cycle. So in 2016, we see orders in the line of 52 million, that decreases to 22 million in 2017, and then up again in 2018, down again in 2019 and 2020. So this does seem like a somewhat regular procurement cycle. We'll of course have more data in future years to comment on that. However, if this is just the normal downswing of a procurement cycle, that does have implications for the couple years of protection that are shipped because of the unique high CYP factor of that particular method. That's not to say, of course, the copper IUD is the only method contributing CYPs within this mix. You can see that there's an increase in CYPs provided from implants. That increases from 33 to 41 million from 2019 to 2020. So that helps fill some of the gap left by the copper IUD. Similarly, CYPs shipped increase across that green category for the combined and progestin orals, as well as in the injectables category in that dark yellow. So the sum total of these changes in methods is really one that keeps the CYPs shipped the same across the 2019 to 2020 bars. And I think on this next slide, there's another view that shows this in further detail. So if we look at this graph, you can see this is 100% stacked bar view of CYPs shipped on the vertical axis across this 2016 to 2020 period. And even though, of course, the market value, or excuse me, not the market value, the CYPs shipped in each year are different, and you can see the different CYPs shipped noted on top of these stacked bars. there are different mixes of the methods contributing these CYPs in the market in each year. And on the bottom of the slide in this gray bar, we've called out what proportion LARCs, or long-acting reversible methods of contraception, provide of the CYP mix. So LARCs are these IUDs and implants. The shorter term methods are comprised of the orals, injectables, and condoms at the top of each bar. And you can see in 2020 that short-term methods provide the largest proportion of the method mix that they have in this 5-year period. So while LARCs still comprise the majority of the method mix, they're at 62% in 2020, more of the mix is comprised of short-term methods than at any other point within this 5-year period. And as short-term methods tend to have perhaps a higher cost per CYP in general than these LARCs, this is why CYPs remain stable in spite of the fact that market value and market volumes have increased. Moving then from these market views from the Supplier and the RHVIZ data, we then have some insights to share from the donor spend view of the market. So again, we show donor spend, contraceptive procurement spend from UNFPA and USAID. And on this first slide with data from UNFPA's procurement services branch, we can see that spend on contraceptive procurement across the public sector FP 2020 market in 2020 reached a 5-year high. So again, this just runs through 2020. This does not run through the present moment. That said, however, we can see that in 2020, this value for contraceptive spend was 170 million. This is a 5% increase from 2019 to 2020. And across the entire year, this 2020 spend is more than double what we see in 2016. So a notable increase and a 5-year high. Moving then to the trends from USAID, the year-over-year spend also increased in 2020. So USAID's spend on contraceptive procurement was 45 million in 2020. This represents a 20% increase from 2019. It is worth noting, though, that this spend does exclude male and female condoms, and that's done for the sake of consistency, as we want to exclude any global health funded condoms from the USAID mix. Across the 5-year period, we can see a relatively stable trend. Of course, there are some ups and then downs in 2017 and 2019, but overall, a relatively stable view of contraceptive procurement spend across the past 5 years. The last slide that we'll share, or the last set of insights rather, contain this context and color that we referenced that really emerges from our conversations with different stakeholders each year as we share and discuss trends and analyses from the Family Planning Market Report. So this year, as in all years we publish the report, we hold conversations with suppliers, donors, and other partners in the SRH space, and there are key trends that emerge from these conversations. This year, there were 3 high-level trends that kept reemerging in these conversations. So the first is that, and I believe our panelists provided some initial context on this, large-scale procurement disruptions largely did not take place in 2020 in spite of the COVID-19 pandemic. Of course, there were some initial disruptions as the first phase, the first few weeks of the pandemic set in. However, manufacturers were able to resume production fairly quickly. This was in part due to the advocacy and the work of the SRH community to work with governments and help manufacturers navigate lockdowns, in part, of course, due to manufacturers' own efforts to adapt to this changing environment and adopt risk mitigation protocols. But what we heard from stakeholders was really that with some hiccups at the beginning, large-scale procurement was not disrupted in some of the ways that we might have anticipated at the beginning of the pandemic. This, of course, is not to say that COVID-19 had no effect at all on the supply chain. We heard from stakeholders that shipping and freight, for example, did become more expensive. At times, the delays in these processes increased. This report only captures trends in contraceptive procurement, so we wouldn't see that played out in the data that we present today. However, we do know that several areas of this supply chain could have been impacted by COVID based on what we heard from stakeholders. Another trend that emerged in these conversations is that this data shows a particular set of insights. So the data presented in the Family Planning Market Report relates to contraceptive procurement. That reached a 5-year high in 2020, but that does not necessarily indicate that different trends like demand for contraception or uptake in countries necessarily also reached a 5-year high in 2020. This is one particular type of analysis related to contraceptive procurement, but it shouldn't be confused with other kinds of data within this community's toolbox that will show different insights based on different data scope and different pieces of the landscape. And the last theme that really emerged in these conversations with stakeholders was one of uncertainty. Stakeholders were unsure what the future funding environment could look like for contraceptive procurement. And we heard from stakeholders that part of this resilience that we may have seen in 2020 could have come from the fact that substantial funding was committed to product orders within 2019. So that may have contributed to this overall environment of resilience seen in 2020 in this market report. And should that global funding context remain uncertain, it could be challenging to maintain those levels of contraceptive procurement. So we heard from stakeholders that it will be important going forward to double down on efforts to ensure the continuity of services and maintain the affordability of quality assured SRH products for women and girls. I think one last item to note before we open up for Q&A is that should anyone want to read the report, you can find the link available on this slide. And if there are any suppliers here today who have not yet joined the report but would like to, you can please feel free to reach out to me, and my contact information is on this slide. And with that said, I think we can open up for Q&A. I know it may take a minute or two for some of these questions to begin coming in, and I would just want to remind folks that you can direct any questions to the Q&A function in the Zoom webinar, and then we will answer them from there. I see one question coming in so far, so I'm happy to take this one to start. So the question is, given new product introductions in the space, like the hormonal IUD, can we expect to see new products reflected in the report? Yes, so I think the report continues to try to show the most updated trends within the SRH space. So CHI and RHSC are committed to continuing to work with existing suppliers and adding new suppliers wherever it provides further visibility to enhance the view of this public sector FP 2020 market. So we have already begun collecting data for the hormonal IUD to show in the report, and as soon as the necessary publicly available pricing information from the UNFPA contraceptive indicator is available, we look forward to aggregating this data and showing methods like the hormonal IUD and any future product introductions within the market view in the report. Let's see, there's another question here. Why do we see a decline in copper IUD volumes from 2019 to 2020? That's a good question. I think some of the decline in copper IUD volumes, again, could be from the cyclical nature of procurement. So we do see across the 5-year period that some years have more of a copper IUD procurement presence than others. We did see in particular in the data for 2020 that there were, I believe, 3 countries which showed a particularly notable decline in copper IUD volumes. Those countries were Pakistan, Uzbekistan, and India, and they had notably procured larger volumes of the copper IUD in the previous years. So it could be that they were working through stock on hand, and these country-specific spikes were driven by those patterns. We look forward to continuing to monitor this method within future reports. As of now, it looks as though this may be a normal fluctuation in procurement cycles, but it is something that we will continue looking for. see a question about emergency contraceptives. Are emergency contraceptives included in the orals category in the first few slides? Those are actually included in their own category. So within the slides that I shared, as within the FP market report, combined and progestin-only contraceptives are shown in one category, and emergency contraceptives are shown in their own category. And just allow another minute or two for any other questions. Let's see. You mentioned that the FP market report continues to use the 69 FP 2020 countries. Will the scope change in the future given the new FP 2030 structure? So that's another good question. I think the answer is this report will continue to reflect the architecture and the movement that the community is progressing towards. So CHI and RHSC look forward to having conversations about the best way to reflect this in upcoming market reports. Given the timing in which we began collecting supplier shipment data, we have continued to use the 69 FP 2020 structure for this year's report, but look forward to moving towards the most updated architecture in coming iterations of the report. Martyn, are there any comments you'd like to add on this FP 2030 architecture?
No, great question, and you're absolutely spot on there, Mary Grace. As I mentioned earlier on, the focus of our measurement efforts will center around the 82 low-income and lower middle-income countries. But we are open to commitments from all countries around the world, including upper middle-income and high-income countries. So I think we'll need to have a good robust conversation about the best set of focus countries, obviously, as John laid out earlier on, including upper middle income countries. I think John brings us up to about 135 countries in total. So we'll work closely with you. But now that we've got our set up our architecture ready for the next 10 years, we'll want to make sure that we're all in alignment with each other in these next critical few months ahead of the next market report, our measurement report, the LEAP report, John, and all of the other interlocking pieces of this work.
Great, thank you, Martyn. I see a question from True related to pricing in the report. So how are changes in category pricing reflected? Specifically, the IAP implant price of $850 is used, but DKT and DALA lowered that price to $690. This is a very important question and clarification, True, so thank you for bringing this up. I think there's perhaps one piece of the question that I'd like to clarify before diving into this. So we use only the values from the UNFPA contraceptive price indicator to calculate the value of the market. So we actually don't use that $850 from IAP to calculate market value. We instead use what is most recently available on the UNFPA contraceptive price indicator. And there's a discussion of the importance of these pricing changes in recent years, due in fact, we suspect, to the enhanced number of quality assured implant suppliers on the market. So the UNFPA contraceptive price indicator in 2019 showed that the aggregate price across all implant sales, I believe, was 8.37. And then that dropped further in 2020, I believe, to 8.26. And our understanding is that this aggregate value of implant sales across the community is being brought down just because of the dynamics that you mentioned, because there are an increased number of suppliers and further suppliers of quality assured affordable implants. So we do see these downward trends in pricing pressure applied within the report. I think perhaps the $850 price that you mentioned is from Exhibit 4 in the report, where we show cost per CYP calculations. So that exhibit within the report is shown for illustrative purposes to show the breakdown of the cost per CYP provided by different methods. We want to be able to show that even though perhaps some methods are more inexpensive, if you compare a male condom, say, to an implant, you need to take into account the fact that while they have different costs, their duration lasts for different periods. And so the cost per CYP needs to be compared in a comparable manner. The issue that we run into is that, as you may be familiar with, the UNFPA contraceptive price indicator does not disaggregate into 3-year and 5-year implants. And, I think there are many good reasons why that may be the case. There's, of course, the need to protect supplier confidentiality. There's the need to maintain appropriate aggregation of data. So I think, as much as we would like to show 3-year and 5-year implants in a disaggregated way with their own individual prices, the solution that we've arrived at for that particular cost per CYP exhibit is we, of course, need to disaggregate the 3-year and the 5-year implant as they have different couple years of protection factors. But knowing that we don't have that consistently updated publicly available source of pricing from the UNFPA contraceptive price indicator, which we would need to conduct those calculations of the cost per CYP, we use the 850 price, recognizing that it is a generalization. There are different prices across different suppliers, but we want to be able to show in an illustrative manner that there are different cost per CYP calculations that would distinguish an implant or a long-acting method of contraception from a short-term method of contraception. So that's an illustrative calculation, but the actual calculation of market value does encapsulate that decrease in prices that we see across implants, which we agree is an important trend to show and really does represent important progress made from having quality assured suppliers enter the market. I hope that provides some clarity. I'm happy to open this up to our panelists if they have anything further to add here. And Drew, please feel free to share any follow-ups if you have them.
I think you answered it well, Mary Grace. Thank you.
Great. And I see a question from Samia. Market shaping for implants has helped this product, as well as activities around the hormonal IUD. Looking to the future and into the crystal ball, what arguments can we make for market shaping for self-care products? I'm happy to field this one to our panelists. I think from the perspective of the FP market report, the only thing I would perhaps say is that we can see that the market tends to benefit in terms of value and volumes from having multiple quality assured suppliers, and we see that reflected in the healthy marketplace trends within this report. But I'm happy to turn that over to any of our panelists should they want to add on.
I can add on perhaps a little bit to this and looking forward to tackling the private sector, commercial sector question as well. So thank you, Samia, for that question. And I think from a market shaping perspective, self-care will undoubtedly generate a lot of interest from the private sector to the commercial sector. And I think that is where, from a market shaping perspective, it could be very, very interesting to look at a total market approach. And the fact that, volumes can be generated both from the public sector and also the private sector in a holistic strategy moving forward, I think that should certainly enable some interesting market shaping strategies. Of course, I have no crystal ball. If I did, I would be funding SRH globally. But for now, I think it's a really interesting question. I look forward to discussing more with many of you these opportunities with regard to self-care products.
And maybe I can also add something to that. This is John Skibiak here. I think the value of market shaping has clearly been demonstrated, as Samia pointed out. But I think the relevance and the appropriateness of market shaping for any product is not just derivative of that product. It's the relationship between the product and the market as a whole. And so I think really to answer that question, or really the potential for market shaping, with regards to any product, one needs to understand the strength of the market, the demand for that product, and I think all of these factors will contribute to determining the role of market shaping and increasing access. Market shaping, if not handled well and not handled carefully, can also do a lot of damage to the market. And so I think it's important that we sort of place this within a broader context.
Thanks, Marie Chantale. Thanks, John. If I could just add that the demand is certainly there, Samia, from FP 2030 countries. Time and again, self-care within expanding method choice is articulated across the 10-year vision for these countries. But that expertise, that high quality expertise, as John says, to ensure that it's done well, done effectively, that demand needs to be met by us all as a family planning community. And it's critically important as well, I think, in terms of cost effectiveness, finite resources, and ensuring that those go as far as possible. So I do think a wide range of countries are going to be asking for this expertise, and will want to be able to meet countries where they are and where they want to go.
And of course, just to end on that, it's Marie Chantale again. I think, market shaping is very broad. We need to ensure we are thinking through, based on the particular dynamics surrounding a product and a market, using our tools, or the basket of tools that are at their disposal. I mean, there's just not one tool. There are a number of tools. And to John's point, and to your point, Martyn, we have to think through strategically what are the tools we can bring to bear in what situation, and ensure we're doing it to enhance the market as a whole.
Thank you, everyone. I think perhaps one last question before we have to close out today. And I know that we've started to touch on this, but are there any plans to expand the report to include private or commercial procurement data or estimates? I think that's an important question, as our conversation has begun to touch on. The Family Planning Market Report in particular is focused on the public sector as it's defined, including that MOH and institutional procurement. But as we've mentioned a few times today, this is just one tool within the community's toolbox. And I know that there are a variety of other reports that do comment on the private sector and the commercial sector, and recognize this is an important area for the community to enhance visibility. So I know that both RHSC and FP 2030 have some familiarity with private sector visibility analyses. So Martyn or John, if there's anything that you'd like to add here, please feel free.
Maybe I can just say kind of a word or two on that. I mean, I think there's sort of two questions here. One is that sort of the appropriateness for this report to be addressing private sector questions, and then the sort of the broader interest in the private sector itself. We certainly, through the LEAP report, look at the role of the private sector and try to measure the contribution of the private sector to overall supply. And that's certainly an activity that we're going to carry on looking at in the years to come. I think the market report has a way of working. It has data sources that it's relied on, and I think to change that could change the very essence of the market report itself. So whether this becomes the opportunity to do that, or whether we look for other opportunities, I think, you know, we'll just need to explore that internally. Already, I think with the changes that are taking place within FP 2030, that itself will bring about some changes in the way we look at this moving forward. So yeah, let me just end there.
Absolutely, John. And you know, we rely very substantially on the excellent LEAP report. Our measurement of this is still evolving. We do set out, for example, not in terms of procurement, but in terms of out-of-pocket expenditure through the private sector in our measurement report. You'll be able to see that as a proportion of the total expenditure on family planning in the 82 countries.
Great. I believe we are right at time. So I will say just a big thank you to everyone, to our panelists for joining, and for everyone who dialed into the webinar today. I know that we may have some remaining questions, but I would welcome anyone who didn't have their question answered to either reach out to me or to the panelists, and we're happy to provide any further context. So a big thank you to everyone for joining today. We appreciate the time and the discussion.
Thank you, everyone.
Bye-bye.
Thanks so much, everyone. Appreciate it.
Have a good day.
Bye.
Yeah.